fluid line inside the nasal cavity. Because before insertion you should see whether there is any kind of obstruction. Some people may have nasal polyps, okay, etc. So once it is ruled out, you can gradually begin to insert it. Now, what is the procedure actually? How will you know that up to what depth you have to insert? From the tragus, you have to go up to the central incisor. This you see there. Can you see locate the upper central incisor? This is the upper central incisor. Upper central incisor. Left side, right side. So here. Then you can go from here up to the Xiphister. So that will give you the depth up to which you have to insert it. And it has to go in the digestive tract. It should go in the esophagus. Through the nose or pharynx, it will enter the esophagus. It should not go into the airway. ED-tube is meant for the airway, but this is meant for the digestive tract, isn't it? So you through your upper ear, you will insert it, and you will ask the patient to swallow. In an unconscious patient, it is easy because the conscious patient will always try to, because it is irritating, he will try to obstruct. So the patient has to bear and should be a little cooperative. So gradually you will insert it, and how you know that it has gone in the foot pipe? One thing is there. In some cases, when there is any fluid, etc., in the stomach, it will come out. So there is a tube, there is a cap, right? Gastric lavage is useful only up to the first 1 hour of poison. Up to 1 hour. Beyond 1 hour, it does not have any value. They say that time since ingestion, 0 to 40, 0 to 40 is actually the golden time. Means 40 minutes. After that, the practical utility of gastric lavage decreases. We, in situations, even do it after 1 hour, but it does not hold any good promise. But if it is done as early as possible from exposure, it's fine. So, you have inserted the tube. Now, how do you know that the tube has gone inside the, again you have to auscultation. When you have inserted an ED tube, you have to auscultate and hear for the breath sounds. It's not it. When you have connected the ambu bag to the tube, ED tube, you will push it, you will compress the bag. So when you compress the bag and as you put over the chest and you auscultate, you can hear the sound as the air is entering. Similarly here also, as you have inserted the nasogastric tube, you can take some air in a syringe and then push the air. Your friend has to put it over the epigastric, over the stomach. So when you push it air, you can hear the sound of air gushing in. It's air insufficient. So it will tell you that it has reached to the stomach. Then next step comes how you do the lavage. This RAS tube is now in position. You have to secure the RAS tube with an adhesive tap so that it is not removed. Then you have to start the lavage. For lavage you need lavage fluid. Yes, that lavage fluid is also called adequate. So you can use normal saline, you can use distilled water, you can even use plain tap water. In your bird, if you are having plain tap water, that tap water also you can use. So in that process, what you have to do, you better take a, this is 50 cc. So you can instill, say I am taking plain tap water. So I have taken plain tap water, I have connected the syringe to the tube, and I have pushed in the water. Fine. Again, I will repeat the procedure. So at one point of time, I can push in at least 150 to 200 ml. And let that liver fluid stay in the stomach for some time. Then I will take it out and aspirate it out. And I will, this first aspirate, which I shall be taking out, I should collect it in a container. This first lavage aspirate I should collect. Say I have collected 150 ml of what I have instilled in, I am collecting it again. I am aspirating it out and collecting in a container. Now that container in which I have collected the lavage fluid along with the gastric contents, I should not throw it. I have to preserve it because this is a very useful sample for doing toxicological study in poison. Okay. So that I will keep. Then I will continue the lavage process. How long I should continue? Till the patient, the aspirate becomes clean. I should continue this lavage procedure. So that is gastric lavage. I can also administer activated charcoal. Activated charcoal comes in as a black fine powder. So activated charcoal is a powder. Now how am I going to administer it to the patient? Powder is a solute. Yes, you need a solvent. You can take water or you can even take sorbitol. Sorbitol